Hello everyone, today we'll be talking about personality disorder and emotional focus therapy. And first I would like to go over what are personality disorders. So of course we have three clusters here, cluster A, cluster B and cluster C. And first, I would like to say that personality is the way of thinking, feeling, and behaving that makes a person different from other people. An individual's personality is influenced by experiences, environment, surrounding, life situation, and inherited characteristics. So the American Psychological Association described effective treatment as integrative and having strong alliances built by therapists who can provide patience, empathy, acceptance, and congruence. Also, treatment delivery by therapists comfortable with long-term emotionally intense relationships, and using interventions that match clients' functional impairment and their readiness to change, and structured treatment that balances acceptance and directiveness within intervention. And knowing this, so I would like to talk about the core difficulties which clients struggle with when they experience personality disorders. So the first, I would say, difficulty would be cognitive weakness in self and other reflection, or it's often termed as difficulties with mentalization. Second, there is general emotional dysregulation with concurrent difficulty processing experience in awareness. A non-individuated client with a weakened capacity to self-reflect is vulnerable, of course, to experiencing a continuous normal relationship between decreased self-awareness and increased levels of emotional arousal is also noted. And this client often will not be able to engage in the separation process. This will be because the client's deep maladaptive fears of being existentially alone are often triggered, and they may be unable to tolerate experiencing these fears. Instead of asserting or letting go, they will often instead express their habitual problems of relating to the powerful other work. And so this would be a problem with EFT when we work with EFT, because there will be a lot of times maybe difficulty of engaging, a difficulty of creating a healthy relationship with the therapist, and sometimes even we can observe disconnection or isolation. And most problematic for EFT chair work is that such a client is most vulnerable to over-arousal and weakened self-reflection in interpersonal context. So the goals then for us, it's that it's very important for the EFT therapist to notice that a particular client has this type of problems. Yeah, maybe more like dysregulation, emotional dysregulation, not being able to connect and to establish a relationship with the therapist, and these individuation problems will lead to the need for us to adjust EFT so it could work effectively with this type of clients. And the EFT therapist can become aware of the problematic so-called dance their client has learned from early interpersonal context. And the EFT therapist tries to, of course, support the client, expressing assertive boundaries toward of their needs to let go of problematic, dominant other during chair work. And what are the patterns in clients with personality disorder? The pattern is first maladaptive interpersonal dances and complementary behavior, and also their interpersonal narratives of unfinished business communicate subjective experiences of being helpless to impact their interpersonal world. Also, the problem solution. The problem when we see people with personal disorders that the client expressing a complementary social response to a dominant other's leading social behavior through two dimensions: connection, which holds at its two poles, warm love and cold hate, and the second dimension is control, with one pole expressing total dominance and control, and the opposite pole expressing freedom, granting and giving control. And the solution is that the EFT therapist commonly can help this less dominant or dominated side of the client to express their pain, to assert their adaptive needs and stand their ground. The client is then helped, and sometimes with work on self-interruption, to ask or demand from the more dominant side that their needs be met. And separation is normally achieved by expressing primary adaptive emotion, either by distancing from the other, by boundary setting with anger, or by letting go of the other through expressing pain and grief. And what are some clinical strategies? Here I listed a couple of strategies. Of course, the first one is to maintain a client's engagement in a chair task. Simplify the chair task to match their current level of functioning. Emphasize certain aspects that support resolution or success in the chair task. Create a context in which the client's over arousal is regulated. So the therapist needs to be aware of the client's limitations and demonstrate successful modeling of components needed to resolve the chair work. And the therapist also can use chair work by proxy. This is best used, this type of work, with a client who cannot tolerate chaotic and multiple emotions, and a client who cannot engage the emotional dialogue task beyond their capability. And to help a client like this, instead of the therapist having a relationship with parts, as in couples model, the therapist adaptively express difficult emotions in more organized way for the client, so to channel the client adaptive emotions and put them in contact with an imagined other for the client. Using the therapy relationship for change, of course, the priority of the therapist is to provide safe contact, empathic understanding, unconditional positive regard. Of course, help the client to meet unmet needs for acceptance, for connection, for support. And of course, this way trying to regulate deep feelings of isolation, shame, and helplessness. Emotional teaching is most helpful when it's brought into a session when the client emits markers of readiness. And the therapist needs to be very aware and know when the client is ready for this. And how we can change, of course, emotion with emotion. The strategies is to employ experiential skills that center on transforming and regulating emotion with emotion. Use dialectical style of empathy. Sometimes the therapist can use humor to help client engage playfully in therapy dialogue. When we're feeling the feeling, we get to know more and explore our experience and the meaning of feeling. And the therapist can help the client process the grief, like acknowledgement first of the losses, and can work on the client's feelings for threat and danger and fear, and this maladaptive fear, which is limitation and barrier that prevents us to move forward. And then the therapist needs to help the client identify the trigger which causes a situation to self or others. And the therapist also need to help the client realize that emotions are carriers of personal meanings and they inform us and of something, maybe something that's out of balance, out of harmony in our lives, and gives us a signal, and they are very important. They're significant for our well-being. And this is how we can work with people with personality disorders through EFT. Thank you for listening.